Welcome back to LASIK Details, all about refractive surgeries. Now that we have talked about the brief overview of eye correction surgeries and the different procedures available in our previous video, link in the description below, let's now talk about the best time to get the procedure done. While there is no predefined age when it comes to getting refractive surgeries done, doctors generally refrain from doing it to patients less than 18 years of age. One primary reason is that the vision keeps changing till adulthood. In fact, some doctors even suggest waiting till the age of 21, so as to get a couple of years buffer before going for the surgeries. So, the ideal minimum age would be 21 years. Coming to the upper age limit. Again, there is no fixed age defined as such. But, typically, it doesn't make much sense to get the surgeries done once you are around 40. Post-40, for most people, the chances of farsightedness increase. Also, once we age, the symptoms of cataracts also start showing up, which might require surgery for someone around 50 years of age. Therefore, it is not advised to get the surgery post-40. However, if still there are justified reasons, there is no stopping as such. The doctors would conduct more vigorous health examinations in such patients to determine their eligibility. One aspect to keep in mind while planning the surgeries is to avoid the monsoon season, as that generally increases the chances of post-surgery infections. So, plan the surgery well before the monsoons so complete healing happens before the onset of monsoons, or plan it once the monsoons are over. Coming up next is the non-exhaustive list of pre-tests that could be performed by your ophthalmologist to assess the various parameters of the eyes and accordingly check eligibility for refractive surgery. Refraction test is the most commonly performed eye test that is also done by your local optician to check the prescription needed in your glasses or contact lenses. It is also called a vision test. As part of this, the doctor normally starts by using a computerized refractor that measures how much light is getting reflected by your retina. You will need to look into the refractor, one eye at a time, while the doctor makes some adjustments from the other side of the machine to change focus and throw in light. Post this initial examination, you will be seated and put on something called a phoropter and asked to look at a chart of letters about 20 feet away. Examining one eye at a time, you will be required to read the smallest row of letters in the chart. The doctor will change the lenses on the phoropter and ask you which one is the clearest. Once done for both eyes, the doctor has the combination that is best suited to you. When this is done as a pre-test for refractive surgeries, the doctors need to ensure that the power is stable and not frequently changing. The pentacam is a topography diagnostic test equipment that is used to test the cornea shape and other parameters. Simply put, it takes high-resolution pictures of cross-sections of the cornea and the area behind it, including the iris and the lens. The machine can make complex calculations that can measure corneal thickness, anterior chamber depth, all kinds of dioptric values of the cornea, and a lot of other technical values. The doctor will give go-ahead for the procedure only if a certain cutoff has been met. Corvi's test is performed to diagnose keratoconus in corneas. It is a condition of thinning out of the cornea that leads it to bulge in a conical shape. This leads to the light, and in turn image, getting out of focus, and therefore making the vision blurry. This machine has a high-speed Scheimpflug camera that is capable of taking over 4,300 images in 1 second. and thus offer great precision when it comes to the different measurements of corneal thickness. It basically records how cornea reacts to a sudden pulse of air, and instantaneously captures the images of that reaction. As part of dilation test, special eye drops are used to dilate, or widen, the pupils. The function of the pupil is to let light in. When the eyes are dilated, this lets iris's muscles relax and in turn let more light in. This lets the doctor check the health of the eyes more effectively. Even the optical nerve can be seen when the eyes are dilated. Once dilated, it could take around 6 hours for the vision to be normal. Some side effects include increased sensitivity to light, blurry vision, and difficulty in focusing on nearer objects. Therefore, it is advisable to have someone accompany you for this exam. Fundus, or ophthalmoscopy eye examination, is done with the eyes dilated, to look at the back of the eye in order to screen for eye ailments. The equipment used as part of the examination test is called an ophthalmoscope. The lights in the examination room are dimmed. The ophthalmoscope throws a pointed light beam of light while the doctor looks at the back of the eyes. Post-mydriatic test is generally the last of the tests performed before giving a go-ahead for the surgery. It is also called the dry refraction test, done when the pupils are in a non-dilated state. This is the same as the latter part of the refraction test, wherein different combinations of lenses are used to check the accurate power of the eyes by reading the smallest row of letters on the chart. The results of the dilation test are taken as a reference for this test. Tonometry test is done to measure the pressure inside your eyes. It is most commonly done as an early screening for glaucoma. The non-contact tonometry, which is normally done as part of screening for refractive procedures, is also commonly called the air puff test since it throws a puff of air to measure the pressure, also referring to as IOP or intraocular eye pressure. Next we talk about the human eye anatomy. Also, we will discuss the precautions and tips that need to be taken care of before and after the surgery. Please subscribe to the channel so that you do not miss on the important information that will get periodically uploaded here. If you like the information, please click on the like button so that these videos reach out to many more people who are exploring to get their vision corrected.